So we're on part 2 of our videos for squats for seniors. And we've seen in part 1 that squat is a sort of a functional movement, and we're going to build it up using progressive exercise, so exercise which gradually gets more difficult. So in this video we're going to have a look at a couple of common errors during the squat. So the first one is that as we squat down onto the bench, rather than our knees staying apart, our knees come together. And that sort of knock-knee position, or official name is knee valgus, can cause a few little problems. It can put a little bit of stress on the inside of the knee. It's not a wrong movement, but if you've got some knee pain and you find it stirs it up, then there's an easy way to compensate. So what we do is, if you think about it, as my knees come in, I'm taking weight towards the little toe, towards the big toe side of the foot. So as my knees come in, I'm taking weight towards the big toe side of the foot. So what I want to do instead is to take weight towards the little toe side of my foot. So as I come down, I'm thinking about the base of my foot as being a triangle. At the back we've got the heel, and then we've got the big toe and the little toe. And I want to be roughly equal on that as I'm standing. And as I press down, if I think, oh, I'm pushing a bit too hard on my big toe side, I drive the knees apart and I push into the little toe side of the foot. And if you find that difficult, one of the things that you'll see people do in a gym is to use one of these, which is a resistance band, and it goes around your knees so that you've got something to push against. And you might have some different bands and things at home, but even if you haven't, what you can do is just get something light, like a piece of elastic, and sort of strap it around the knee. So first thing is, to put it on, we need to sit down so that we're not going to stumble. And then you put your feet apart, turning them out slightly, and it goes just below the knee. So now it's pulling my knees inwards. I'm going to push constantly against the band as I sit back down. So I'm pressing against that band as I sit back down, and that's pressing the weight onto the little toe side of my foot. All right. So the second fault that we can find is that as you bend forwards, you tend to do this. You tend to round forwards. And a good trick, I've got a yoga block here, but a good trick is to imagine that your breastbone is a block, or it contains a light. So as I bend forwards, that searchlight points forwards to the floor. And what I want to do is as I squat, keep the searchlight pointing away from me, so pointing at the opposite wall of this room. So as soon as I feel the searchlight points down towards the floor, I try to correct that and point it at the wall. So what I'm trying to do is to open my chest up a little bit, and rather than coming into this position, I'm lifting upwards. All right, so we've got two common faults there. One is a knock-knee position, and the other is rounding, and we can compensate and correct both of those. So in the next video, we'll have a look at a couple more faults. Thanks for looking.